Hello everybody. Okay, we finished the Turkish presentation. Now it's in English. I'm late again, so let's start promptly. You guys can join one by one. So, as you know, our challenge, triple system, summer body challenge is ending tomorrow. There are people who got great results, and I'm going to announce those tomorrow. And we're going to put their, the measurements and how they reached their metabolic health, and they lost the belly fat they were complaining about. So we got great results. The people who dropped off, at least they now know the safest ways to lose weight, to reach their metabolic health. The safest way, as I said, intermittent fasting, but the variation of the intermittent fasting, the safest way, and also alkaline diet, anti-inflammatory diet, and the safest calorie reduction. So you all learn these are in your toolbox right now. Okay, so we will communicate regarding the end of the challenge. Okay, so let's go into menopausal hormone treatment promptly. So menopausal hormone treatment, we've been discussing this in the last few weeks, right? So as I've been advocating for you, this is your right. Okay, as a woman after 50, we wanted to live more than 50 more years, right? So like maybe 100, 120. You don't want to live rest of your life after 50 in suffering, all these symptoms and risks, and Alzheimer's, heart attack, like osteoporosis. You don't want to live in a low quality of life, right? That's why this hormone treatment is a huge thing. Don't think like, okay, it's hormonal, it can be done or not done. No, in my opinion, it must be done. Okay, of course it is still your personal preference, but I'm telling you, we'll explain and I'll give all the information. They are safer. The safest medications, the hormones we are prescribing as providers. Okay, so they are not something that we can compare like in the past. So these hormones right now, new hormones, are bioidentical. They are the closest to our woman's body. Okay, the same molecule is from the plants. Okay, so it's the safest. So let's start. So we women will all have menopause one day, right? So now I give you all the information so that you can discuss this with your doctor. Okay, the last 3 weeks I've been giving, go back and listen to those. If you cannot find on Facebook anymore, if it's erased from Facebook, it's in YouTube. You can watch from those as well. How it prevents these 3 deadly diseases. These are very important, right? So I'm giving you the basic and safest information right now so that you can start a conversation with your doctor. Okay, so doctors are hesitant because there are many variations, and there is this study, it's abruptly finished in 2001, 2002 I think, and then it took 3 years and they started seeing some side effects and things. But remember, the hormones were different, like birth control pills. It's just like, we know birth control pills are not really ideal, right? So it's quite different than those days. Okay, so that's why doctors are hesitant. So, and they don't have a lot of knowledge. They just don't want to get into this area. Okay, that's why there's the knowledge deficit. So you get knowledgeable yourself. That's how it starts with me too. One of my patients came and said, I want to start bioidentical hormones. That opened my eyes. And now, you see, I'm going to show you right now, even I started using it. Okay? So, maybe you're going to be that patient, going and asking doctor and opening doctor's eyes, and maybe help other women too. Okay, so let's start. What is menopause? Menopause is end of ovarian function, okay? No menses, no menstrual periods for 12 months, or after surgical removal, like early, even like in 30s, 20s, if your uterus, ovary is removed, that's, you know, that's menopause, right? So why does menopause happen? Our body is designed that way, okay? The nature didn't think that we were going to live after the menopause, after the reproductive age, but you know, with the advancements and you know, the lifestyle and everything, we live longer than our, you know, our reproductive age, right? So maybe we live like 100 years. So that's why we have to look into these tools so that we can live happily and healthily after 50s too, okay, with good quality of life. Okay, so perimenopause, you know, like after menopause, okay, around the average age is 51, but this perimenopause can go back down to like 7 years, 10 years, and in some cases it's reported even all the way down to 27, age 27, we may start having symptoms of perimenopause, okay? So what are these symptoms? Your periods may become irregular, hot flashes, night sweats, insomnia, mood swings, anxiety, fatigue, forgetfulness. That's one of the things my patients come with. Bladder discomfort, frequent UTIs, incontinence, you know, you're leaking, you just like urgency, achy joints, palpitations, weight gain. You know, we talked about this weight gain, right? It's just like patients come and say that, okay, I'm eating the same food, my activity level is the same, what's going on with this midsection weight gain, and then I can't even, you know, get rid of it, doesn't budge. So that's menopausal weight gain. Okay, so palpitations. Many patients around mid-age, like, you know, 40s, like go to the ER for palpitations, and what do? They just check EKGs and things. They refer the patient to cardiology. What cardiology does? More advanced testing, and they can find anything. Okay, here is your metoprolol, here is your medication, and then that's the end of it, and that's not even a solution, right? So years and years of suffering, and it doesn't get better from that point. So we have to be our own advocate, okay? So as I said, estrogen is not only for reproduction, okay? Not only to have a baby, okay? It is related to at least 300 functions. It's a hormone that affects 300 functions in our body, okay? Heart vessels, heat regulation, bone building, okay? We have receptors in all those areas, like brain function. We have estrogen receptors in our brain, vessels, heart, bones, even colon, okay? Like colon cancer risk increases after menopause, okay? Estrogen is anti-inflammatory. That's why when we start the estrogen with the patients, it's big improvement, okay? So cholesterol clearance is better after we start the estrogen, okay? So that's very important to consider. It's not just like, okay, maybe if doctor offers it, I'll take it. It's not something like that. You are the one who's gonna go and make that conversation, okay? Cognitive function. I told you like 2-3 weeks ago, Dr. Lisa Mosconi's study is just very important. You're losing executive function. Many of my patients, they come, they say that mid-sentence, they forget what to say. That's very bad. And these are, you know, highly influential people. They give presentations. That's very embarrassing. Some of them even have to quit their jobs or retire early. That's very bad, you know, very low quality of life, right? So as soon as we give estrogen, the brain improves, okay? So 70, some studies say 80% of reduction in Alzheimer's after the estrogen treatment. So why are we leaving it on the table, right? Okay, estrogen is neuroprotective, increases neuroplasticity. You can learn better, you can learn more, okay? So, bone health, as we know, I mentioned last week, 2% of bone loss every year after menopause, the first 5 years. It means that 5 years after your menopause, you already lost 10% of your bones. That's not fair, okay? And after that, 1% every year. So, if we can extend this, isn't that great? This is actually estrogen hormone treatment is the #1 osteoporosis medication approved by FDA in United States, okay? So why are you leaving it on the table? And doctors don't even offer. They just offer you other alendronase bisphosphonates, which has a lot of side effects, okay? Estrogen, and it's bioidentical, okay? So, colon cancer reduction, bendability of the bone. It's not like stick bone, like, you know, it has its own elasticity because of the estrogen. Your heart vessels are gonna be elastic, okay? Blood pressure problems start after menopause, but you can get rid of this problem by just continuing the estrogen in your body, right? So why struggle? Okay, we can even prevent some type of cancers. It's very well known. Okay, risk of HRT. So as we say, the first 10 years is very safe. Okay, you don't even need to do any testing. So until 60, age 60, because considering average age for menopause is like 51, until 60, you can start the treatment unless you have breast cancer yourself, okay? That's why in that situation, maybe your doctor may stop, or liver disease or something you have. So we'll talk about those a little later, but the first 10 years is very safe. So, but after 10 years, why is it a little bit risky? For heart, for example. So in those 10 years of no estrogen state in your body, your heart and your heart vessels get stiffer, right? There may be even like plaque buildup. So when you initiate estrogen after these 10 years, because estrogen makes things softer, it may break those plaques. That's the problem, okay? But you can always evaluate, doctors can evaluate if this patient has plaques anyway. If there are no plaques, there is no risk, right? So, for example, coronary artery calcium score test. With your cholesterol testing, there is this Boston Heart Health, score. So, and then, you can check all those, or you can go to cardiology and do stress tests. If you do those tests, and then, again, after age 60, it can still be started. Okay, it just needs evaluation. Otherwise, don't accept as a no. Do not accept that, okay? So, you just need an evaluation, basically. So, it's good you're not smoking, those kind of things important too. So, as I said, like, have birth control pills cause, blood clots and things. If you're taking estrogen by mouth, that may cause blood clots too. That's why doctors after age 60, they can check if you have this factor 5 deficiency, for example, those kind of coagulation problems. They can check, and if there is no problem in your liver and no liver disease, nothing, they can still start it, okay? But it doesn't have to be by mouth, as I say, because everything you take from the mouth goes through liver, right? So there are other methods of estradiol, putting estrogen in your body. So we'll talk about those a little later, okay? So do not accept an answer that's, doctor refuses. Okay, so you just rule out the risks and then you can start. Okay, why are the doctors fearful, right? There was a study I said, in the study group, the one that took hormones and not took hormones. So there was only one case more in 1,000 patient population of breast cancer. So with non-hormonal group had 4 in 1,000, but the one that took hormone 5 in 1,000. So just one case in 1,000 there was an increase in the breast cancer. But remember, the estrogen at that time was different, and it's oral. It was from horse urine, pregnant horse urine. So yes, there were a lot of things wrong in that study. Okay, they are different right now, bioidentical. So those risks are not the same as with the bioidentical we're using right now. So that's why doctors have this hesitation. Okay, and if the patients are not asking for it, they are not going into this area. Okay. Okay, so how long can we take it? Patients ask, for example, when we start, how long can we take it? You can take it as long as you want, as long as you don't have any side effects to it. You can continue taking it. Okay, there is no age limit. 80, 90, you can take it. Okay. Okay, can I start at my 60s? I told you earlier that because it may cause rupture in those soft plaques after age 60. That's why we want some workup with that. Okay, it needs to be always, encouraged to be integrated with good nutrition, a lot of fiber, plant dominant diet, and exercise. Okay, you don't just take the medications and expect everything from the hormone, right? So okay, hormone testing. Patients are coming to me, can we test my hormones? You do not need to test hormones, especially before you lost your period for like over a year. So within that year, if you're still having the periods, there's a lot of fluctuation. There is fluctuation even in the same day, from morning to evening. That's why that's not a valuable test. Even after menopause, we think that it's zero, right? No, like we don't check it, we go by your symptoms. Okay, so we can just start with low dose, gradually increase it until your symptoms stop, and then you feel happy and like all yourself, and then probably that's the right dose for you. But at the end of the year, maybe once a year, we can check the estradiol level to see if we're giving too much or something. Okay, so no need for hormonal testing. Okay, some people ask, can I stop after a certain time? Yes, you can. If you want to stop it, you can stop. Nobody can, can say anything about that. That's your decision. But you need to be mindful that as soon as you stop, even next day, the brain, the heart, and the bones, you're losing the estrogen. All those receptor sites are, empty. They're not having estrogen anymore. So decline starts the moment you're stopping the estrogen hormone therapy. Next day, the decline starts. So if you don't have any symptoms, just keep going with that. There's no problem. Okay. So, okay, what is this hormone therapy? What's entitled? As I said, mainly estrogen treatment, right? This estrogen treatment can be done systemically and locally. Locally means like vaginally, because we have vaginal symptoms, right? Dryness, frequent UTIs, there's a problem thinning and losing the elasticity in that area. So frequent urinary tract infections, our patients are coming. So even if you don't want to give systemic estrogen to prevent Alzheimer's, heart disease, or osteoporosis, you can still give vaginal estrogen locally just by, inserting a vaginal tablet to even like 90-year-old ladies. Okay, it's better than dying of sepsis because of the urinary tract infection, right? So, Okay, whole body hormones. Let's say, yeah, write down whole body hormones. Vaginal are different. So whole body hormones, like pills. There are pills, estradiol pills you take every day. There are patches, so I will show you the one I'm using. This is the patch, you know, when you open this, it's a little band-aid, a little bit like transparent. It's like a size of my nail, thumbnail. So, because this is one of the lowest doses, so when you increase, because I just started, my dose is low, so when I increase, the patch size is going to be bigger as well. Okay, so this is the patch you put under your belly button. Mine is twice a week. There are weekly patches as well. So the one my doctor prescribed is twice a week. So every 3 days I change the patch. Okay. So sometimes it can come with a gel, you know, systemic gel. Sometimes there's vaginal gel. We'll talk about that too. That gel, you know, depends on the dose, I guess. You know, the gel can be systemic as well. And there are rings also that can be local and also systemic depending on the dose. Okay, there is a spray, there is injection. So estradiol can come with these, systemic estrogen can come with these different variations, right? So low dose vaginal estrogen. This one, as I told you, to prevent vaginal and urinary symptoms. So this is, it comes in the box like this, different brand names in every country. So it is like this. Every night you're inserting one of these. There is a pill at the end of this. So here there's the pill. This is like applying a tampon, right? So you pull this plunger, and then usually it's good to put a lubricant. I put coconut oil. So you insert it, and then you push the plunger, and then the little tablet, little white tablet stays inside, you know, close to your cervix, inside the vagina. So this is to prevent you don't do this every day. So the first 2 weeks you do it every day. After that, twice a week. So maintenance dose. After 2 weeks you go into maintenance dose. Okay. So, but as I told you, there are vaginal gel preparations and also ring for local symptoms, right? So, but a lot of people prefer this one I showed you, because vaginal creams is kind of like messy sometimes. So, but if you're using it, you can use it around the labia to prevent that thinning as well. So these are low dose vaginal estrogens I showed you. So if you still have uterus, you need to use progesterone as well, because like during the years, you know, when we were menstruating, there is progesterone that comes into play after 2 weeks, and then it starts shedding the uterine lining, right? So that's why you need progesterone. Otherwise, your uterine lining gets thicker and thicker and thicker, and may cause uterine cancer. So to prevent that, there is progesterone. If you still have uterus, you need to take the progesterone as well. So I'll show you, it's a little pearl. So you take it every night. So even if you don't have uterus anymore, this is still a good thing to take, especially if you have postmenopausal insomnia, irritability, some, you know, like anxiety. This calms you down. Okay, this is good not only for uterine lining, it's also good for your brain. Okay, so you can continue taking. So these 3 things basically: patch, vaginal, patch goes on your belly, and this is the pill. You take progesterone for your uterine lining and for your brain, like for your sleep and everything. Okay, so I started that last week, and then I have an appointment in 6 weeks, and probably they are going to increase the dose. Okay, so combination therapy. This is the combination therapy. Sometimes there are combined pills as well. And then, you know, sometimes progesterone can go in as a uterine coil as well. It's like Mirena, for example. You get the progesterone from there, but that's only for endometrium. It's not gonna work for your brain, like for your, you know, irritability or to relax you. So that's a local progesterone, this Mirena IUD, intrauterine device, basically. It has little progesterone in it. Okay, so is HRT right for you? Okay, so let's go on that one. As I told you, this is the discussion every woman can make with their doctor. Yes, we're saying up until age 60, but even after that, okay? With the risk evaluation, you can do that, because remember, even if you don't have symptoms right now, you don't have hot flashes, you don't have insomnia, you're sleeping like a baby, you have no problems, let's say, menopause related, it's like before, you only lost your period, but remember the long-term risks, Alzheimer risk, heart attack risk, osteoporosis risk, you're preventing those are huge, okay? Every one woman in two women, like 50% of us are dying of heart attack after menopause, okay? So Alzheimer, I gave you the statistics. Every 3 Alzheimer cases, 2 of them are women, okay? So basically, we have risk of double risk compared to men of getting Alzheimer's, okay? So who doesn't want to prevent these, right? Okay, so who shouldn't take hormone replacement treatment? As I said, if you have breast cancer, doctor may hesitate. So there are little nuances in that, but that's totally depend on your, you can still make the discussion, okay? Especially if if it's not estrogen related breast cancer and it's been a while, and then you can still do vaginal local estrogens. So you still need to talk to your doctor if you're considering it. So there are nuances that it's not a flat no, okay? So there are possibilities. Okay, so it may cause vaginal bleeding, a little bit spotting, so it will go away in, you know, within a few months, so no problem there. If you had history of blood clots, doctor may deny you, and also if you're smoking, doctor may deny you. If you have liver and gallbladder disease, doctor may deny you, okay? So as I said, it may cause vaginal bleeding a little bit. For a while, it goes away later. Breast tenderness, that goes away. If there is a little bit mood swings, that will go away later. A little bit bloating maybe, they all improve, okay? So you may develop a little bit irritation around the patch, so then you may seek another form of maybe gel. You know, you can ask your doctor if there is irritation with the allergy to the glue in the patch, okay? So okay, we will still be very active. We're not going to expect everything from these hormones, okay? For bone building, for Alzheimer, for heart attack, we're going to eat good. We're going to do our exercise, okay? Fiber-rich food. Okay, so I'm finishing off right now. As I said, it doesn't matter if you have the symptoms right now. The second half of our life, we want to live in dignity, with good quality of life, okay? So as I said, these are bioidentical. It's nothing like comparable to the previous ones, okay? Get yourself educated. Listen to other providers, doctors on YouTube or social media. Get yourself educated and make this discussion with your doctor, okay? So there's always one type that would work for you, okay? So do not accept a flat no from your doctor. Change your doctor, okay? Go find another one. So there are online ones. My provider is online. This is like Hormone Clinic, Midi Health, Aloe is good, you know, all those hormonal, they are good. Okay, so they know, they've been doing this for a while, they know what to do. Okay, this is the safest prescriptions we make every day. Okay, this is the safest. So it's better than prescribing bisphosphonates for bone building, for bone osteoporosis. It's better than prescribing heart medications. It's better than prescribing medications for Alzheimer's. Okay, these hormones are going to prevent you, reduce your risk for these three, especially these main three deadly diseases. Okay, so I'm finishing off right now. So I'm giving a summer break. So I'll come back. You can always communicate with me. I will answer your questions. We will be in touch. Okay, what subjects you want me to discuss, you know, for future, we can always I can always work on those too. So I will always answer your questions. As I say, tomorrow I will announce the winners of the challenge for our Summer Body Triple System Challenge. Okay, so we will keep in touch. Okay, bye now. Have a beautiful summer. Okay, bye.